So it's been a while, but I haven't. I did part 1, and then it's just been busy since then. So this is part 2. Sorry for the delay. You might notice that I shaved my beard off, which was a mistake, and so it's in the middle of growing back now. Yeah, I'm not as sick as I look. It's just, this is 3 days growth. Anyway, so the first step in the journey was to get a PSA test done, and it came through that I was of an age, I'm 63 years old, of an age where I get a, not an annual I don't think, but a PSA test done. PSA stands for prostate specific antigen. You see, I've got notes, I'm cheating because I'm trying to get through a lot. Prostate specific antigen. And that's the test you get. It's a simple blood test. And I just want to answer some questions that I've been asked since I had a diagnosis, which is now back in February, and it's now June. And I would say there are no stupid questions. Some of these we think, oh, everybody knows what this is, but some of you don't. So I'm going to try and explain as we go along what things are. I always ask questions, whether it's your doctors or friends. Just say, what's that like and what does that look like? It's fine. And as Ted Lasso says, be curious, not judgmental. So the first question, which some of you know what, but why would you know this? Does everyone have a prostate? Well, if you're male, and I mean that in the biological sense, not just what you are choosing to call yourself, but what you're born with. If you're born with male genitalia, you have a prostate. If you're female, you don't. And the prostate is a gland that sits just under the bladder, about the size of a walnut. So not a huge thing really. It gets bigger as you get older. And its primary function is to produce a fluid to nourish and help transport semen. So it's a reproductive part of the reproductive system, fairly crucial for men's operation and function. And the PSA test is done purely to check if there's anything wrong down there. And PSA is a protein. It's produced by cancerous and non-cancerous tissue in the prostate. So a high PSA test could indicate that you've got a cancer, but it could also indicate there's something else. So don't panic if you immediately get a high PSA test, is what I would say. Just wait for the next bit and don't, predict the future. It could be that you've got an enlarged prostate or an infection or something else, but it could be cancer. So you need to keep getting it checked. So you have a blood test. The next question was, does a blood test hurt? No, it doesn't. In actual fact, the ones I've had recently, I didn't even feel it. They said, oh, you feel a little scratch. It doesn't hurt at all. They're not running at you with a big javelin. It's just it takes a minute maybe. I didn't feel it. You may feel it. And if you're a bit woozy, you just must. I used to, feel like I was going to pass out years ago when I had blood tests. Even the thought of it would make me go woozy. Now I've become, I don't know, I just don't. But if you do, just say to them that, and it's fine. They're used to that. They do these all the time where people pass out and faint and feel sick and all the rest of it. Just say, can I lay down while you do this? Or I do, just, say what's going on, and they're fine. There's no shame in it. They take a little, a vial of blood, not a pint. They're not going to take loads of blood, which is the other question. How much do they take? So it just takes a few seconds really. It's in, out, done, and you're gone. You might have a little bruise afterwards. I didn't, but sometimes I have, where depending on the nurse who takes the blood. When I went for the blood test, they first checked my urine to make sure I didn't have any kind of urine infection going on, because that would give you a false reading. So you do that, you have to go and they give you the weirdest, awkward shaped things. You have to pee into a little cup, which is like, what am I, a mouse? You have to pee in this little cup, and then you have to transport that into another thing. And in the toilets in my doctor's surgery, there are no shelves to put something. So you think, I've got two things in my hand, and things are loose here. So what am I supposed to do with all these bits whilst I'm trying to pee into a microscopic bloody thing? Anyway, that's for the doctors. Put a shelf in your toilet so you can put stuff on it and some wipes, then you can wipe it down, fine. So the nurse then dips a little bit of paper into that, into your wee when you go in there to see, and that shows up instantly if there's any infection. Now, before you have mine was fine, by the way. A very good vintage, good year for urine. So then they take the blood, and before you have your PSA test done, they tell you to refrain from certain activities. No exercise of any sort for 48 hours before the test, and no sexual activity for 48 hours before the test. And there's not a polite way of putting this, and for some of you this is disgusting, some of you it's your lifestyle choice, but no anal sex of any description for a week before you have the test, because all these things stimulate the prostate and can give you a higher reading. So you have to refrain from that for that reason, otherwise you'll get a high reading, then you'll go through lots of other stuff for no real reason. So, you know, refrain. So before taking the blood, the nurse says, you haven't done any exercise over the last 48 hours, have you? And I said, yeah, look at me. Do I look like I've done any exercise at all? I haven't done any exercise for the last 40 years. And then she says, and you haven't had sex for the last 48 hours, have you? And I said, well, all right, don't rub it in. Took the blood, off you go, that's fine. And that's the blood test done. And then you get the results. I got the results back a few days later. I had a call, and my PSA came back at 5.9, and the max for my age was 4.5. So not horrific, but not good. So the nurse on the phone who spoke to me explained it all. She was really lovely, and then she said, "Oh, the next thing now is you'll get an appointment either to have a biopsy or an MRI scan." And then on the Friday that week, so this was all within a week really. On the Friday that week, I had a call from Frimley Park Hospital, which is my nearest hospital to me, and they're very good there, to say, "Can you come in on Sunday morning for an MRI?" And I said, I can't come in Sunday morning because I've got church on Sunday morning and I'm the pastor and I'm teaching. So they said, that's fine, come in the afternoon. I thought, wow, this is brilliant. So I went in 2:30, had the MRI scan, and all that. So what's an MRI is probably the next question that anybody might have. An MRI stands for magnetic resonance imaging. So you're basically in this, I'll put a picture up, but it's a sort of donut-shaped thing that that's loads of magnets in it that go around and create a picture. I'm not scientific, clearly, or an engineer, but it's quite a noisy machine. When you're in it, you get ear defenders to put on, which they can still speak to you through when they're talking to you, and you go in this machine. If you're claustrophobic at all, it might be an issue, but in my case I went in feet first anyway. I have had an MRI, I've had a brain scan before where you're in head first. It's really not that bad. You just close your eyes and relax and do that. But the MRI, there's no pain involved in it. You're just in a machine. It's a bit noisy and thuds a bit as you're in there. But you go in there feet first. And then they put a cannula in your wrist. Now, cannula's a needle, so it goes in a vein in your wrist, so that they can then put some dye into your blood at a certain point during again, that doesn't hurt, it's just a little scratch, and they stick it down, and you know, it's nothing, you don't feel that from that point on, it's really nothing to worry about. But they need to put some dye into your system because that shows up any anomalies there. It gets into your circulation and shows up any cancerous cells. So yeah, you've got the ear defenders on, you're in there. You don't have to, as long as you've got nothing metal on you, you can go in there with your tracksuit bottoms on and stuff like that. It's going to go through that. I had a metal belt on my buckle, so I was just down to my pants and t-shirt. It's traditional for men to keep their socks on in these situations, but you know, I took mine off because I'm a gentleman. So you're in there, and then there's two people in there Really lovely people, explained it all to you. They explain it all the way along. Are you okay? Are you feeling okay? Do you feel faint? Are you good with needles? And they check you all the way through, and they do this all day. So whatever your concerns are, you just say them and they'll deal with you appropriately. It's all good. Whole thing's totally painless. About halfway through, they inject this fluid in, and you feel like a cold as it goes up your arm and starts to go, and that's all it was really. You just felt, and they tell you that's what's going to happen. And other than the little scratch, you feel nothing. It's not absolutely nothing to worry about. You're not undergoing anything painful. You won't get the results there and then. You have to wait for somebody to kind of read the results and say what's in them. So you have to wait for that. In my case, I got an appointment about 5 days later to go and get the results. Onto the MRI results, and this is where the rubber hits the road. This is where, if you're going for your MRI results, you need to take a deep breath. I got the letter through, just to warn you, I got the letter through, said it's a 15-minute appointment and with a nurse specialist practitioner. And I thought, oh, it's probably nothing to worry about, because they've not said a consultant, and they haven't said bring somebody with you, which you think if they're giving me bad news, they'll probably get you to take somebody with you. Take somebody with you, particularly if you're nervous, but take somebody with you anyway. So I got there, and the nurse, who again was really lovely, really knowledgeable, and my experience, the nurse practitioners are the best people to speak to, because consultants won't like this, but they probably know as much as the consultants, but they can't do the operations. But they are really knowledgeable about what your treatment looks like, what's likely to happen, the possibilities. So they are really good, and they have a lot more empathy than a lot of the consultants do, because the consultants seem to be on a different kind of a wavelength to the rest of humanity a lot of the time. But you want those guys operating on you, but you want somebody with heart to talk to you as well. So I went along, and she was building up to, oh, we've got your results back. And I thought, if it was good news, you'd be saying straight away, firstly, there's nothing to worry about. So we kind of knew where she was going. My wife had come in with me, and she said, there's this area of concern, and you think, oh, okay. So I wasn't really expecting it to be cancer, but in the back of your mind, you know, it's there. But and then it's, yeah, this, we need to have a look at this, so we're going to do a biopsy on it, and and they grade it. So they tell you what sort of size it is. She showed me the picture, and it was a 14mm cancer, which in something that's the size of a walnut is a reasonable size, but not huge. So it wasn't like then they'd caught it. As I say, I had no symptoms. I didn't go because I was feeling sick. Still don't feel sick, even though I look a bit rough at the moment. I'm not feeling poorly. So you know, you think, well, you expect to feel poorly, don't you, when you've got something, but you don't. Prostate cancer, invariably, you have no symptoms. So it's a little weird, but we knew something was wrong in the build-up. Yeah, so we looked at the scan, and there it was, a little, and it comes up like shiny because of the dye that they've put in, I think. It says if there's a cancer, it will be white, and this thing was like a beacon shining from that area where the prostate is, and you think, oh, well, you don't need a microscope to sort of see that. It's quite easily seen. So then she said the next step would be a biopsy, where they take some biological samples from the cancer itself. So because it's a little bit, it's not ambiguous, but it's like it's described as an area of concern, and we think this is, you know, there is something, and you know, so I'm very much like, give me the facts sort of thing. What is this? And so we said, look, is the biopsy likely to come back as clear? To which she said, no, the MRI is what we go by more than anything. The MRI is pretty clear. the biopsy will tell us what kind of cancer it is, not is it cancer or not. So I was like, so it's cancer then. So you just have to get that in your head. And honestly, I said this in the last one, I am a Christian. My faith is very real to me. My relationship with God is very real to me. I had perfect peace right from the start. It's a gift that was given to me at that moment, that like, I'm not going to get stressed out about this. I'm not going to get anxious about it. It is what it is. And where it goes, it goes. For me, it wasn't like the end of the world. It wasn't as disastrous as it could be. So that's it. I have cancer. The last bit of this, after seeing the nurse and doing that, though, I will tell you this: the last part of this appointment, she said, I will have to do a digital examination before you go. Now, nobody had done that up till this point, actually, which you think is the first thing they're going to do, but nobody had done that. But she assured me she had small fingers, which I thought was amusing. But so she, my wife couldn't get out of there quick enough at this point. She's like, yep, don't want to see that, don't want anything to do with that end of things. So she was out of there, and you have to get used to embarrassment and awkward things. And again, it's just one of those things. Nobody's going to enjoy this, are they? So you get over, you're on your side, sort of almost a fetal position, your knees up, and then tells you you're just going to a bit of lubricant, and then slips a finger in your bum and feels around the prostate, which is just an odd sensation. But honestly, it's not the worst thing that'll ever happen to you. It's, you just have to get over the embarrassment. And she tells you what she can feel and all that. And then that's that. It takes seconds, I suppose, to do that. It's not a long thing. Then you pull your trousers up and off you go. And then we had a chat about church after that, which is just an odd thing, isn't it? 1 minute, this strange woman, I've never met her before, got a finger up my bum, and now we're talking about church and coffee and cakes and what we do and all that. And it's the bizarreness of it. You have to laugh, really. There'll be another video following on for this, and I'm going to explain the biopsy, because that's quite. You have to see the funny side of a biopsy, trust me. And I'll say some of the things that people have said that will say to you in that as well. I'm going to, I just feel like I want to end just by praying for anybody who's going through stuff now, who's just not sure what the future holds. So if you want to switch off at this point, that's fine. So if you are with me, if you're still with me, just close your eyes. And Father, I do thank you that you are God, and you love us, your creation. I thank you for everything that I have, and I thank you for your peace. And I pray, Father, that you would give peace to anybody who needs it right now. I pray, Father, that you would just put your arms around any guys out there who are anxious about their cancer, at whatever stage they are, Lord. And I pray, Father, that you would meet them, and that they would just feel your presence with them, Lord, and they would find peace. I'm so grateful for the peace I have. In fact, I'd rather have the peace than have my health, if I'm honest, because that is the thing that seems to elude me a lot of the time. So, Father, I pray your peace on anybody who's still with us now and watching this, and just bless them, I pray, in Jesus' name. Amen.